I'm Barb Fisher. Thanks for joining us. I am here with Ariel Kukofka and Christine Epling, who are mental health specialists for Poudre School District's mental health team. We're going to talk about things parents can do, in particular communication, that helps develop your relationship with the child and your child's mental health. The greatest prevention for mental health is good communication and a good relationship with your kids. So Ariel, let's start with you. How do we talk so our child will listen? And how do we listen so our child will talk?
So communication is at the heart of the relationship with your child. And the pattern of communication that you develop is going to start when the child is very young. So it's important to have a positive, open pattern of communication. We want to communicate with the child so that they feel well understood, and that can be really challenging. There are specific skills to use when you are listening and responding to your child, and I like to use the acronym LOVE, LOVE, to remember those skills. When you are listening to your child, you want to listen with an open mind. So you're going to give them your full, undivided attention, and as much as you can, set aside any judgment that you have around what they're saying in the moment. And then when you are responding to your child, you want to validate with empathy. Validating means you're letting them know you hear exactly what they're trying to communicate. Their perception, though, is their reality. You may not buy into exactly what they're saying. Nonetheless, do the best you can to empathize, stand in their shoes, tune into what they're feeling, and hear what they're saying. Again, their perception is their reality. And finally, communication is not just about the tough topics. All along, you want to be able to have a good time with your child. Have lots of fun. Communicate with humor. Enjoy your child's company. Remember, it doesn't have to be about discipline or all business.
We don't always have to be the parent, the heavy. We can be
Exactly.
playful and have fun with our kids, and that is a huge contributor to their mental health because they feel safer with us.
That's right.
With better communication, with better all-around relationship together.
That's right.
But there are some topics that are a lot harder to talk to our kids about that we might be hesitant to bring up. We might not feel like we have the tools. We don't want to hear the answer. Or we wonder if we're violating our child's privacy. Christine, what are the tougher topics and how can we as parents approach them?
Well, I think some of the really difficult topics, both for parents and for kids, are things like alcohol, drugs, sex, suicide, death. All those tend to be ones that we would rather avoid rather than talk with them about it. But it's so important to make sure that we are having those conversations. It's especially important to make sure that we address it directly with our kids. We want to talk to them with very open and clear terms. Different age groups are going to understand things differently, so we have to make sure that we're speaking to them at a developmentally appropriate level. Our 7-year-old versus our 11-year-old versus our 15-year-old, the conversation might look a little bit different, but it's still going to be really clear, really direct. Our experience working with kids, especially little ones, is that euphemisms don't go over very well. They tend to get really confused if we're not using really clear terms and being really direct. So for example, when we talk with the little guys about death, for example, a lot of times we want to use the words passed away, and we have lots of kids that ask us, well, what does that mean? Where did they pass to? What's going on? Are they coming back? So it's really important to make sure we're being really direct and we're using those really clear terms with them. The conversation about these tough topics doesn't have to be a one-time shot. It can be an ongoing process. It really should be ongoing. We want to make sure we're bringing this up at different times and in different ways. Going back to what Ariel had said, having those open lines of communication, having that positive communication with our kiddos is going to be one of the most important things. It's so important when kids ask us questions that we use what Ariel talked about for listening with them, but it's also important to make sure that we answer their questions honestly and directly. That will help continue to keep those lines of communication open. And if you're ever not sure, some topics are really tough and some people aren't exactly sure how to broach those. You can always use different resources, and calling your school counselor can be a great resource if you're not sure how to broach a topic.
Tough topics. You know, obviously there's been a number of tragedies in the PSD community with suicides. And that's a pretty tough topic to raise with your child. How should a parent respond if their kid maybe says something like they should just die, or they know a friend who has said they're going to take their life, or there's been a suicide in the overall community? How should a parent deal with that?
Well, that is a very challenging topic for really anybody. And hopefully you've already laid that foundation of open communication with your child. That will pave the path to making this somewhat easier conversation to have. It can be a scary topic nonetheless, and so you may not be sure how to react in the moment. The first thing to do is take a deep breath, remind yourself it is going to be okay. You will handle this conversation all right, and you just want to bring your best self to the moment with your child. Like any other difficult topic, as Christine just said, you want to address the issue head on, directly, using clear words. Don't beat around the bush, and using age-appropriate language. As Christine said, it's going to look different when you talk about how somebody died or suicide with a first grader than even with a fifth grader. They're both elementary school, but that's a very different conversation, and it's going to feel different. You know your child best. Stick with that, and you're going to be fine. So remember, we're going to go back to those basic communication skills that allow your child to feel understood and for you to communicate what you mean clearly. That means you're going to be listening with an open, non-judgmental attitude, and you're ready to hear what your child has to say in that moment. And then you're going to validate your child with empathy. The bottom line is, again, their perception is their reality. So if they believe they are in crisis, then they are in crisis. And they need you to be present in that crisis with them, even if you don't believe them, which can, with children, often be hard to do. That's all right. They need you to be there for them anyway. The most important aspect of the conversation is that you hear what your child is saying and you let them know that you've heard and understood them.
You know, that is excellent. I think it's really tempting to minimize what our child has to say, and maybe because we all were minimized as children, or maybe it's just, you know, it makes us feel more comfortable if we do that. But that doesn't help them speak to us more or foster their mental health. So once a child, Christine, once a child has said to you, hey, I'm worried about this, or hey, I'm not happy, what do you do? What is a parent to do?
Yeah, that's a great question. It can be kind of tough. So if your kid has come to you and they have let you know that they are thinking about hurting themselves or wanting to kill themselves, or that one of their friends has said similar things, we've got a couple of things we want people to do. We've got 4 steps specifically. First thing is that it's so important to make sure we take it seriously. Even if you don't believe it, even if you're not sure if it's true, as Ariel said, really none of that matters. We have to take it seriously in that moment. Second thing we're going to ask you to do is drop everything and pay attention. Kid needs your full attention at this point. Again, crisis to them means it's a crisis. Third thing we're going to look at doing is, if it's your child that's just told you this, it's the person that you are with has told you that they are thinking about hurting themselves or killing themselves, we don't ever want to leave them alone. So we want to make sure that we keep somebody with that child at all times. And the fourth thing we're going to do is get some help.
That's really good. And where do you get help? What are the resources?
So there's a couple of different great places that we can go. We can always go over to the emergency room. They have an assessment center right there in the emergency room with trained mental health professionals that can do an assessment on anyone that comes in. We also have a community crisis center that's 24 hours a day, 7 days a week, where you can walk in with any kind of crisis. You can utilize your school resources if your child has come to you about themselves, or especially if they've come about someone that they know, then we would definitely encourage you to call the school, talk to the counselor, talk to an administrator, talk to a teacher, let them know what's going on, and they can help guide parents in the right direction. If the family happens to have a therapist that they're working with, either parents therapist, child's therapist, family therapist, that's a great resource to go to. Family physician, same thing, great resource. They can help get parents connected with mental health services if needed. And of course, if it's a medical emergency, we want to make sure that we call 911 immediately.
Sure. Well, Christine, Ariel, thank you for providing this information to us. There's some great tools for parents to use, and we really appreciate it. Thank you for joining us today.